in this particular gynecomastia, I did liposuction in this area first. And if you can zoom in here, you can kind of get an idea, or just kind of get closer. Yeah, did liposuction first and contoured this a lot, and you can see the fullness that's in comparison on this side. But after I've done the liposuction, there's still this area of tissue that's rock hard underneath the areola here, and that's what's giving it this rounded dome-like appearance. It's the tissue that remains. So if you have liposuction performed alone, oftentimes this tissue is going to remain, and that's what's going to give you this sensation of fullness and appearance of puffy nipples. So that's why in the majority of gynecomastia cases, I contour the chest very nicely to get this nice sculpted edge along the muscle, and then I have to come back, make a small incision around the areola here, and remove this tissue, and hopefully I'll show you that in a second. To contour the fat. And it's not just random liposuction either, it's liposuction to maximize the geometrical contour of the breast area here by taking advantage of the muscle here to give it better definition, more of a geometrical rather than a rounded breast appearance. And in this area here where I suction, my cannula bumps up against the hard tissue that cannot be removed. That's the breast tissue beneath the nipple areola complex here. So that's how you actually know there's tissue that needs to be removed surgically, because you can't get through it with a cannula. So I've done some liposuction and I reduced the fat in this dark line, in this area between this dark line here. And already you can see the border of his pectoralis muscle over here, because I've thinned out this fatty layer here that sometimes extends underneath the arm, and on the lower part of the chest here that was sort of round. So this will become flatter, and already you can see he's got a nicer pec muscle. But because I didn't remove the tissue, you could see here it is between my fingers. Clearly he has a lump of hard, stiff breast tissue that now needs to be removed so that his areola will flatten down. So you can see how when I squeeze on it, the areola becomes more puffy, which is just indicative of the tissue. Relax, it looks better, but that tissue is always underneath there. So that's the next stage of a really fine gynecomastia, is just to remove that residual tissue underneath the areola, which is also variable in amount. In some men it extends into a much larger area, in others it's just localized. My hemi-periareolar incision, hemi is half, areola is this part on the outside, and that's a small smile incision here. And then already you can see that I've dissected under the nipple. You can see this whitish, thick tissue that is the actual breast tissue right here. And this is going to come out, it's probably about the size of a golf ball, so this is what needs to be removed here in order to reduce this puffy nipple. Now the tissue has actually been removed, and this is the tissue here, and you can see this was right underneath the areola. And this is fibro, fatty, thick, rubbery breast tissue that will not be removed with liposuction alone. It's just impossible. So this tissue here, here's the bottom side of his areola, was right in this region, right here, as it normally is. That's what makes for this puffiness. Wipe it down, please. That's what makes for this puffiness. And then you can see, once this golf ball is removed, the areola then collapses. So that's the whole way of getting rid of puffy areola that you can see right here. It's the tissue beneath. Tissue is removed. Voila, it's flatter. This is the drain. Comes out up into the hair-bearing part of the underarm so that the scar is not noticeable, and it goes to a little bulb. And then this bulb, when collapsed, will suction out some of the fluid that tends to accumulate in this area, and you wear this for a few days. It's a little uncomfortable, but it's not bad. The areola, as you can tell, is already wrinkled and collapsed. This is the suture line here that we sutured up, and this should heal very well over time. Oftentimes there's a little bit of a dimple right here at the lowest point of the suture, but that should go away with time. And you can see he has a nice contour overall. You can see the lateral border of his pectoralis major muscle, and he has a more of a boomerang shaped chest as opposed to round.